Welcome back to my channel, Striving on a Better Health, with your girl Sammy. In today's video, we will talk about leukemia. So sit back and relax while I transform your life with knowledge. So guys, what's leukemia? Can anyone tell? So, leukemia is cancer of the blood tissues, bone marrow, and the lymphatic system. But guys, before we move on, let me ask this question. What is the bone marrow? Bone marrow is a soft, spongy tissue in the center cavity of all bones. It is a limited space where all the different types of blood cells are made and where nutrients and other resources are supplied to help these cells grow healthy. Blood cells keep our body healthy and functioning normal. In the bone marrow, different types of blood cells are being produced. Like the red blood cells, these cells carry oxygen and other nutrients to all tissues and organs in the body. Then you have the white blood cells. These cells fight against infections. Then you have the platelets. These cells help the blood with the clotting. Leukemia starts when the DNA of a single cell in the bone marrow changes and can't develop and function normally. So guys, leukemia can develop when there is a rise in the number of abnormal blood cells in the body. It's usually affected the leukocytes or the white blood cells. These white blood cells crowded out the red blood cells, and the extra white blood cells don't work properly. These abnormal blood cells are called blasts or leukemia cells. So guys, let's look at 4 major kinds of leukemia. 1. Acute lymphoblastic leukemia. 2. Chronic lymphocytic leukemia. 3. Acute myelogenous leukemia. 4. Chronic myelogenous leukemia. So guys, acute leukemia is distinguished by a rapid increase in the number of abnormal blood cells. The rapid increase causes the bone marrow to be unable to produce healthy cells, causing a low hemoglobin and low platelets. Immediate treatment is required in acute leukemia. Now guys, let's look at chronic leukemia. Chronic leukemia is characterized by an increase of mature white blood cells, but still abnormal. This type takes months and years to progress, and the cells are produced at a higher rate than normal, causing too many abnormal white blood cells. Immediate treatment is not required, but are carefully monitored for a period of time to ensure maximum effectiveness of all treatment. Now guys, leukemia is characterized also by the cell types. So an acute or chronic leukemia can be myelogenous or lymphocytic leukemia. So guys, lymphocytic leukemia means that the leukemia has developed from the lymphoid cell line, and the myelogenous leukemia means that the leukemia has developed from the myeloid cell line. So guys, what causes leukemia, as I mentioned before, is the abnormal rapid increase of immature blood cells in the bone marrow. So guys, how can a patient be diagnosed with leukemia? What steps are taken or what procedures are performed? Let's find out. So guys, let me help you. They can be diagnosed by having their doctor conduct a physical exam, blood tests, and depending on the results, a bone marrow biopsy. Now guys, with all that information, let's look at some common symptoms of leukemia. Let's move on now guys. How is leukemia treated? Treatment for leukemia depends on the type of leukemia you have, your age, and your overall health, and if the leukemia started to affect any other organs or tissues. Now guys, let's look at 4 methods of treatment. So guys, we have come to the end of this video. I hope you enjoyed listening to me today. Please go ahead and hit the like, share and subscribe button down below, and please leave a comment. Goodbye.